My name is Sean, and I'm a pelvic floor patient at the Westchester location. So I want to tell you a little bit about my story. Over the last 2 years, I got really sick. Lost a lot of weight, almost 50 pounds. Had just a lot of pain and knew something wasn't right, even though I was seeing a doctor here in Ohio, but wasn't making a full recovery. And being so young, I wanted to get back to 100% in that quality of life that I once lived. Last November when my family intervened and ended up bringing me back home to Chicago to really seek some answers for what was going on with me and why I wasn't recovering. And what we found is that I had a lot of ulcers, I had chronic GI and IBS with also constipation at the same time. And my GI in Chicago actually was a big advocate for finding what else could be out there. And thankfully for her and fighting for me and to figure out answers, I was able to find that I tested positive for a few other things, one of them being H. pylori, which we treated. The ulcers we treated, but then also she wanted to test me for pelvic floor dyssynergy. So I came back to Ohio and had to find and go through a few different doctors and keep being an advocate for myself along with my spouse to fight for me to find that answer. One of the fascinating things about what I discovered in Chicago with the GI there is they're very big on not only treating the physical condition, whether it's through procedure, surgery, medication, but they're also very big on treating the holistic approach to recovery. So my recovery actually includes yoga, seeing a psychiatrist on a regular basis, as well as physical therapy. And each of those different practices and team members are actually working in tandem with one another. My physical therapist regularly talks to my GI that I found out here in Ohio, so they're working in tandem. And then my psychiatrist also has reached out to my physical therapist here at Oxford Pelvic Floor, as well as my GI. So this road to recovery and getting back to 100%, I'm not fighting it by myself anymore. I've gone down a journey that, again, a year ago I never thought would be possible. I thought yoga was witchcraft and not a real sport, and really only people that did it that didn't have jobs and stayed home every day. I thought pelvic floor dyssynergy was really for young moms that just pushed out a beautiful baby, and men don't have this issue. But what I've come to realize is I'm not alone in this journey, whether it's men or women, but at the same time the road to recovery is not just one avenue with a GI or with physical therapy or with yoga. It's really, you have to find what works for you, and there is no textbook on to recovery of getting back to 100%. Every patient truly is different, and what works for me is going to be different than what works for the next patient and the next patient. But again, you have to be your own advocate and find the team that believes and supports you and will help you on your mission. Coming here to Oxford has become part of not just my recovery, but this whole mindfulness of what I want to do in order to get back to 100%. I remember December 26th, I came in, I cried, I was in so much pain, both emotionally but also physically, to where I'm at now 5 or 6 months later, that I come in here, it's a celebration, I have milestones of my recovery, but I also know the last 5 or 6 months, there was a lot of people that played a role in that we've had ups, we've had downs, we've made progress, but the team here in Westchester has been with me every step of the way. They reach out to me in between appointments. If I'm off for a week, they reach out just to make sure, the road to recovery is there. If I've had flare-ups, they bring me in to do treatment. They adjust, but they've become almost more of like an extension of my family, because they care not just about me, but getting me back to 100%. They know about my kids, my family, and they want to see me be, the dad that I used to be and I know that I want to be. As again, I'm in my mid-30s, I should be able to run around with my 2 little girls, but I wasn't able to. I actually work with Becca here. She has been amazing. I can't even say enough about her. That I walk in, she just looks at my face and says, "You're having a terrible day." And the whole treatment plan for that day, we adjusted, and I don't even have to ask. She knows that level of detail about each of her patients, and without her, I know I wouldn't be where I'm at. Now I still have a long road to go, and that's been the great thing about Becca and Jill, some of the other team members here, is that they're working with you, but keep pushing you in a sense that you should be able to get back to 100%. And we're a part of that journey, but you got to keep pushing yourself. And you know, over the last few weeks, I've actually graduated a little bit. Now I go out to the gym with Jill, and we do some light weights, throwing some medicine balls, you know, because that's the next step. And that's the nice thing about Oxford here, is that they're willing to work with you and customize your treatment plan for where you're at in your journey, but also where you want to go. They also help keep you accountable on that journey. And you know, for me, my goals are easy. Initially, I want to be able to just go to the bathroom like a normal person without a severe abdominal pain or even maybe the use of medication. And I know physical therapy is helping with that. But then I want to be the dad to my my 4 and 6-year-old daughters, run around with them without having to stop, take a break, run to the restroom because I can't hold my bladder. And then for me personally, I used to be an active marathon runner, and I want to get back there. So I know, you know, my ultimate goal is when I run that next marathon, whether it's Chicago or New York, that to me says, all right, I'm back 100%. And I'd say right now I'm 60% there, but I have champions at Oxford, my GI, my yoga studio, again, working in tandem, pushing me there. And again, without Oxford and Becca, I wouldn't even know where to go. I would refer anyone here in a heartbeat. I wouldn't even think twice about going anywhere else unless Becca, you left and went somewhere. But again, really confused when I started down this journey, because I, like a lot of people, thought really you had to have a baby, push out a beautiful little baby, or pretty much be a female. And so when I started doing research, I was really confused because men do suffer from this, but most of what you read about is, you know, females that suffer from pelvic. It definitely caused me to question, like, is something wrong with me? But, you know, coming here to Oxford, you know, you start to learn really a lot about, you know, the condition itself, but then other people that are dealing with it, and it's not just women. There is a more, I guess, relief that I'm not the only one in this. But men also can suffer from pelvic floor, from incontinence, from, you know, having uncontrollable, you know, whether it's bladder, and it's not just women, and you don't have to push out a baby or have even a traumatic injury to your core to suffer from this condition. Oxford has been absolutely fantastic in working with the cross-functional team to make sure that we're all on the same page, focused on my recovery, and that my interests come first before everything else.